Welcome back. Independence Care System is a dedicated community of professionals committed to serving individuals with disabilities. At ICS, their primary focus lies in enhancing the health, mobility, and independence of their members, enabling them to actively participate and engage members or as engaged members within their communities. ICS is supporting people with disabilities and chronic conditions in maintaining their health and independence, ensuring they can continue living comfortably at home and thriving within their communities. Joining us is the Health Home Advocacy Specialist and co-chair of the Civics League for Disability Rights, Marcus Johnson, and Senior Vice President of Rehab and Mobility Services, Jean Minkel. I want to thank you both so much for joining us.
Thank you.
Thank you. We're welcome.
Now, Jean, can you just give us, for those who are unaware, an overview about your organization, Independence Care System?
Sure. And thank you, particularly in a social justice environment. We're excited to have an opportunity to share our work. We work largely with adults with physical disabilities. Many of our members have a mobility disability, so they're negotiating the world using a wheelchair or a wheeled mobility device. And uh, through our services, largely the coordination of care, as our mission statement says, we want to be sure that people have access to health care that's accessible and understands their disability, that they have access to mobility, meaning they have the right device and the device is in good working condition. And when people are healthy and mobile, they're able to participate and be as independent as they'd like to be and participate in the community. Uh, I'd really ask Marcus to kind of build on that, as he's a person with the lived experience, and I'm a professional in support. But Marcus can really give your audience a much more personal idea of what our work is like and what our successes are.
Right. Well, what Gene is expressing, that's what I really appreciate about Independence Care System, because they take the lived experience. So the narrative you truly hear is the narrative of our members that direct our services for our competent disability care. So being a member and also a colleague, I have a unique perspective, and I work with other colleagues at Independence Care System that also have disabilities as well. And our collaboration, working with our competent professional staff, allows us to thrive in the community independently. Independently. So with Independence Care System's three pillars of health, mobility, and independence, I've been injured this year makes 32 years, and I've been fortunate enough to take the benefits fully of being an individual with a disability, because it was signed into office in 1990. I was injured in 91, and then ADA went into effect in 92. So I've been great to have the benefit of living with a disability and getting direction from great leaders at Independence Care Systems, such as Marilyn Saviola, Anna Faye, and it's just made such a difference. And the Civics League for Disability Rights, we're a group of individuals with disabilities, and we fight for legislation that makes it equitable for us to have health care and navigate the healthcare system. It's not easy, but with Independence Care System, they give us that push, that guidance, and we're changing the landscape of how people with disabilities in New York State are living independently.
Now, I really wanted to, something that really stood out to me was the fact when you said that you're not only just a member, but a colleague as well. And I understand that there are three pillars. Could we first just talk about the three pillars of ICS?
Sure. So health is foundational, and yet people with physical disabilities often have barriers to what you and I would consider just routine services. So accessibility and accessibility in healthcare not only involves physical accessibility. So Marcus referenced our good friend and colleague who unfortunately passed several years ago, but Marilyn Saviola uh, looked for 7 months in 2017 to find an accessible mammography suite for women with a disability, meaning a woman was a wheelchair rider. So something as simple as having ongoing mammography becomes difficult because the wheelchair isn't compatible with the machine that the device is using. And if it was just physical accessibility, that we could work around that. But what our members report to us and what we've experienced when we partner with them is attitudinal accessibility. So when Marilyn went to find the mammography suite, literally a physician met she and her personal assistant in the hallway and said, "You can't come here." She said, "What do you mean I can't come here?" And she goes, "You need to go where people like you go." So just the idea that a self-directing, cognitively intact, capable woman who happens to negotiate the world in a wheelchair was told she couldn't go to a mainstream healthcare facility in New York City. So, and we've seen this over and over again where uh, Marcus referenced disability competent care. So, having healthcare providers who are invested in primary care in addition to whatever the mobility or functional limitation is. So, there's a big gap in care there. So, ICS is working with health and hospitals. We are very tightly connected with our colleagues at Bronx Care, trying to be sure that those of our members who need access, and when I say preventative care, are people getting A1C testing for their diabetes? Are they able to have a colonoscopy? Are they getting immunizations? And what we find is there's an incredible gap in accessibility for that type of preventative health, which then leads to more complications. So, health is accessing accessible healthcare with providers who understand the underlying disability. Our second pillar is mobility. And as a physical therapist and the leader within ICS around our mobility services, Marcus can be the first to tell you when his chair doesn't work, it isn't like you and I that maybe our vehicle doesn't work or the bus was late today. It means your legs don't work and you can't get out of bed. So mobility has equally foundational, profound importance. And thanks to our members, ICS over 20 years has put a mobility services program together that not only looks after getting the right pieces of equipment to allow Marcus to negotiate his environment, protect his skin from pressure injury, and provide him the postural support he needs to sit up 7, 8, 10, 12 hours a day, but also to repair that equipment. And thanks to the advocacy of our members have said, you could have the best repair service in the world, but I need a backup chair. Because when I wake up in the morning and my chair doesn't work, I have to be sure that I have an alternate to be able to negotiate my world. So mobility is access to the right device, access to competent and timely repair services, and access to a backup device or a loaner device so that you can keep moving as your repair services are underway. And as I mentioned in the opening, when someone is enjoying good health, has good function, and able to negotiate and be mobile in the world, then they're participatory in their own life. And that leads to a level of independence. And so many of our members are so appreciative that ICS approaches partnership and really talks about people having consumer directed care, that you know what works for you, you know what doesn't work for you. How can we work in partnership to be sure that we're negotiating the systems of care? One of my favorite sayings is our members aren't complex. The systems of care that they need to engage in are very complex. And that's what our staff tries to do is decrease the complexity of the systems by navigating in partnership with our members so that people can go to work if that's what they want to do, parent if that's what they want to do, engage in volunteer activities if that's what they want to do, engage in social activities the way anybody wants to engage. And if anything, COVID taught all of us, boy, being locked down is really not a great way to live life.
Right.
And if you're disabled, it's like, welcome to our world.
Right.
This is what we've experienced for many years. So we try and break down those access issues so that people have full social ability as well as health and mobility.
Well, Marcus, can you actually just talk about, that independence and what that means for, so many people who are living with disability?
Well, I can say that as an individual with a lived experience, right, and I have a disability, I know the benefit of having ICS in my life, and I also see it through the experiences and relationships I have with my peers with disabilities. So navigating through the world is just that much easier when you're comfortable in the seating position, seating in your chair, and you have confidence when you roll out your door that I'll be fine. I'll be able to make it to my medical appointment, go out with friends, go to school, go to work. And that's what the world needs to understand. People with disabilities are doing the same thing everybody else is doing. And matter of fact, we do it better because our life is so strategic. It's so strategically thought out. It's methodic. Well, we have to make sure if it go here, is it accessible if it goes here? But that also goes that individuals with disability need to be very knowledgeable of how the world does not fit us in, and we have to make them fit us in. The ADA is great; it has a long way to go,
Right.
but the reality of it is, as you mentioned, attitudinal barriers that will always be an issue because people's perceptions are impacting the lives of other people with disabilities. So you need to understand to allow the narrative come from the lived experience if you want to change the landscape of how people with disabilities are living in the communities.
I also want to add something that I learned, which is like pretty amazing. The Americans with Disabilities Act really transformed so much of like the everyday things that everybody pretty much uses and benefits from. And this is from elevators, maybe at the train station, closed captioning on movies. I know when I watch TV, or even like if you're scrolling on TikTok, you'll see that there's closed captioning now, and a lot of that stems from the Americans with Disabilities Act. Can you just talk about that act and how it really impacted, not only the lives of people with disabilities, but just our world, and how if it benefits people without disabilities, I could imagine how much it benefits those who are living with disabilities.
Marcus, start and I'll fill in.
Oh, I can just say what you just brought up is so important because you think about it, closed captioning. Most of the time, we would think about closed captioning when we were watching a foreign film, right? Which I love foreign films, but the reality of it is, closed captioning is just great. It opens the door for everyone or an array of people coping or living life differently. And if you think about it this way, if when disability wins, everybody wins.
Everybody
And
wins.
that's what I love about how the Americans with Disabilities Act, that legislation is making the world notice. And America see that this is a protected class. You need to recognize us because we are not going nowhere.
So I'm really excited that you brought up what we would call universal design. So in meeting the objectives of the ADA, there have been so many benefits for society at large. And I mean, in 1990, I'm not sure they had rolling suitcases. If you travel at all today, everybody has a rolling suitcase. And if you're rolling through the streets of New York, boy, those curb cuts certainly feel like they are universally designed. Every parent in the world who pushes a stroller will tell you, boy, that's really helpful. And having access to ramps where stairs might be right next to it, it's so much easier to push the stroller up the ramp. And yet, and you brought up captioning. I'm right with you as the British mystery fan. Like having the closed captioning makes the viewing experience much easier. And then there's voice input was originally designed as an accommodation for people with disabilities who couldn't access a keyboard. And voice input is now what we all use with "Hey Siri" or "Alexa, do X, Y, or Z." There's the genesis of that technology was really as a reasonable accommodation for people with physical disabilities. But I want to bring up, we talked briefly about healthcare accessibility, and as helpful as the ADA has been, certainly in public building accommodation, in public transportation, there's really been barriers that have not broken down, and healthcare is one of them. You will be shocked how many people will tell you that they had their annual physical while sitting in their wheelchair because the uh, exam table was too high for them to transfer onto, and the facility didn't have a patient lift to help them get onto a proper exam table, just like any able-bodied person would expect to be examined in a supine position. And accountability to meeting the standards of the ADA has been one of its failings, because not one government agency is actually charged with seeing that the requirements of the ADA have been fulfilled. So Marcus said we've come a long way,
Right.
and what has helped come a long way is the disability community holding society accountable. But when, for example, Medicare and Medicaid don't hold a healthcare facility responsible for having accessible equipment, then that's what's adding to the barrier of care. So you can have the legislation, but if you don't have an accountability arm attached to it, you you're not going to get the intended outcomes. And
Well,
these are the fights, as Marcus says, that continue every day.
I have to end it here because we're out of time, but I truly want to thank you both so much for joining us and
Sure.
educating our community, on what's going on. So, once again, thank you so much.
Thank
Thank you
you.
for your interest.
We have to take a quick break. We'll be back right after this.